I want to introduce Rachel Egan. So Rachel is the chair of our Population Health Committee at NHS Greater Manchester. So she's part of our Integrated Care Board. If you're from the arts sector, you've probably just switched off with all those words I've just said. But basically, in charge of population health. She's a non-exec director of NHS Greater Manchester. And she's also a great supporter of the arts.
Thanks, Julie. And as Julie said, I am Rachel Egan, and I'm chair of the Population Health Committee for Greater Manchester NHS. And that feels like a real privilege to me because I'm continually inspired by all the population health team and all the members of that committee who consistently bring their creativity to our conversations about what do we need to do in Greater Manchester to really continue our journey of being the absolute exceptional area for prevention and early intervention. And many people will know some of the great achievements we've had in that space. So people have probably switched off when they heard GMNHS, if they're creative. That's what I heard Julie say. So I'm going to set myself as a little task this morning to try and switch back on. I'm delighted to be here, and I've been invited to give this short keynote, which I really hope will be a sharpener for the day ahead. And I'm hoping to convey why I am a passionate advocate of health creation through arts and culture at 3 levels: a personal level, a systems level, and an NHS level. Let's get personal. As a young carer, still very much a child myself, I was often responsible for my baby sister Grace. Instinctively, when she cried, I sang, because I didn't know what else to do when I had tried a bottle, a nappy change, and a shower of raspberries and funny faces. I sang to her the songs my mum sang to me, that I had heard her sing to Grace before she was born. The melodic rhythms calmed and soothed. Of course, I am referring to me and her, and my singing breath steadied me. My world was loving yet complex, joyful but traumatic, happy but sad. And I'm not sure if Oldham Theatre Workshop found me, or I found it, but being there, accepted for all I was, gave me a sturdy sailing boat that somehow had built-in navigation and the ability to right itself when it capsized. When it came to deciding what I would do when I officially left the school, which at that point I was barely attending, I leant into what had already become central to my world. I studied community theatre. I don't think it's especially relevant, but it did include spending a day as the personification of a Zippo lighter. How times have changed. GM is surely the poster child for making smoking history. I digress. Back to community theatre. For me, it was a rediscovery through an academic lens, what I had known since childhood, that the arts give people power. Power to heal, to connect, to grow, define and redefine themselves and their narrative. Filled with passion and wonder, I went straight to Style Prison as an artist in residence. I don't think I was ever a particularly talented artist, but I was great at positively enabling others. I found my way into local government via St. Bart's Hospital, Pegasus Theatre, and numerous community theatre projects and arts projects and public health. Throughout my 25 years in education and social care, I have been asked consistently, why are you here? It isn't that people in local government were exploring an existential position, more that they didn't view local government as an environment where creativity could thrive. You already know the answer. I am so grateful for the opportunity it gave me to influence the system, leaving droplets of creativity as I went that were attracted by and found their way to droplets scattered by others. to become wonderful, vibrant puddles, refreshing, revitalising rain, which manifested as creative infrastructure in a world too often overshadowed by bureaucracy. To the present, this room, filled with talented people and organisations who are the embodiment of creative health in GM. GM-based organisations with a long history of creative health in this place, including Venture Arts, Start Salford, ARC in Stockport, who are recognised as developing the first ever Arts on Prescription programme in England. I've just realised I need this type of prescription with my HRT. Fortunately, I know how to artistically self-medicate. GM-based organisations combined with national organisations, including Rambert and the ENO, now based in GM, who are expanding their award-winning Breathe programme, already working with respiratory experts and communities. You heard from our Deputy Mayor about Live Well GM, a radical shift to create stronger, healthier, happier society. I wanted to link this to the concept of cradle to grave, but it doesn't quite fit because we now know that the first 1,001 days are crucial to development and life chances. I refuse to be celebratory about 70% or thereabouts of children reaching a good level of development. Less if children live in poverty, are male, from racially marginalised communities, have a learning disability, are known to or in the care of local authorities, have a parent or carer with long conditions or mental health, ill health, because it means that thousands of children are not getting a good start, not getting a brain blueprint that will support them to thrive. They are starting from a place of inequality, which will grow and grow and grow unless we make a radical shift. That is the very essence of Creative Health GM. Later this morning, there is a panel session on the role of creativity in early years, followed by deep dive sessions to explore how we enable people to live well and thrive. Thriving means hope. Believing in the sun even when it's not shining. Perhaps hope is the as yet untangible factor that allows us all to be greater than, more than. Clinical models need to be infused with creativity and hope, so they become part of a health creation ecosystem, enjoying a symbiotic relationship. I've left my partner at home today with their pain medication dispensed into time-labelled dishes, neurodiverse, as prescribed. How uplifting if alongside they have been prescribed a selection of Sofigo and opera. Creativity, and therefore creative health, is one of GM's greatest resources for economic inclusion, social connection, and wellness realisation. Our evolving neighbourhood blueprint needs every neighbourhood to have creative health as part of its local health infrastructure, because wellness is connection, enrichment, and a system that focuses on people beyond their medical diagnosis. We are proud to be the world's first creative health city region, and we thank the Arts Council England for its support through the National Lottery-funded Place Partnership Fund. Everyone in this room is leading the way in harnessing the power of culture and creativity in improving health. Creative social prescribing, breathing techniques as part of singing, mental health support through creative engagement. As we launch our delivery plan, we have a unique opportunity, and I invite you today to seize that opportunity, to take the time today to connect with people that you don't already know, and also just to have a think about what might be your creative resolution for 2025. Thank you.